WNYC Studios is supported by Wise. Wise, the smart way to manage the currencies you need around the world. With the Wise account, you can send, spend, and receive in up to 40 currencies with only a few simple taps. Be smart. Get Wise. Download the Wise app today. Terms and conditions apply. WNYC Studios is supported by Odoo. When you buy business software from lots of vendors, the costs add up and it gets complicated and confusing. Odoo solves this. It's a single company that sells a suite of enterprise apps that handles everything from accounting to inventory to sales. Odoo is all connected on a single platform in a simple and affordable way. You can save money without missing out on the features you need. Check out Odoo at odoo.com. That's odoo.com.
It's the Brian Lehrer Show on WNYC. I'm Tiffany Hansen in for Brian today. Good morning again, everybody. All right, joining us now is Sarah Kliff, an investigative healthcare reporter at the New York Times. She and her co-reporter, Margot Sanger-Katz, published a major investigation into how the applied behavior analysis therapy industry, which treats children with autism, has exploded into a multi-billion-dollar business fueled by Medicaid dollars, private equity investment, and almost no regulatory oversight. Their reporting centers on Complete Kids, a fast-growing chain of autism clinics in North Carolina. They found a pattern of overbilling, overprescribed hours, and documented instances of child abuse. The investigation lands at a time when the Trump administration has identified autism therapy as a, quote, high-priority focus for fraud enforcement, that according to Kliff's investigation. Sarah Kliff, welcome back to WNYC. Glad to have you.
Thank you for having me back.
And listeners, we'd like you in this conversation as well. For those of you with children who are currently in that applied behavior analysis therapy, that ABA therapy, we'd love to hear from you. What has your experience been like for your child? What does your child get out of attending an autism clinic that they wouldn't get out of attending a school in a school setting? 212-433-9692. You can call us. You can text us at that number. Okay. Sarah, you focus, as I said, your investigation on this Complete Kids clinic in North Carolina. You had an example you wrote about a 6-year-old girl who fell asleep in her therapist's lap and was woken up after 7 minutes because it didn't comply with company policy. Naps can't go longer than 7 minutes. First of all, what does that tell us about how that specific example really tell us about how these clinics operate? And then what was it like for you to witness that?
Yeah. So the 7-minute figure, it's something we'd heard in our reporting, something that people who worked at the clinic were troubled by. And then we actually, like you mentioned, saw this little girl being woken up after falling asleep. And it struck us as an odd and relatively short amount of time for children to nap. But what we learned is that this behavior, applied behavior analysis, or ABA as it's often called, is typically billed in 15-minute increments to Medicaid and other health plans. And a child has to be awake and performing therapy for the majority of that 15-minute increment. So the policy at this clinic is that after 7 minutes, you need to wake them up so the child can be awake and performing therapy for 8 minutes, and that 15-minute unit can be billed to the health plan. So this really was rooted in billing and keeping the clock going on the billable hours for these children. And we did visit one of the clinics, and there was this incident where a girl did fall asleep, and it was pretty tricky for her to wake up. Multiple people tried. It was she seemed pretty solidly asleep, but they did eventually get her up, and that is, the policy there. And they have defended this policy in our conversations, have said, look, in order to avoid committing Medicaid fraud, we have to keep the billing going, and therefore we need to have a policy like this to keep ourselves safe.
Let's talk a little bit about how we got to this point. You said that in your article that nationwide, Medicaid spending on autism therapy has nearly tripled between 2020 and 2024. And that in North Carolina specifically, so this area that you're focusing on, this Complete Kids in Concord, North Carolina, In the state of North Carolina, specifically, that state projects it will spend over $1 billion next year.
Mhm.
Now you talk about Colorado, for example, spending more on autism therapy than all of their emergency department visits combined.
Mhm.
Talk to us about how we got here.
Yeah, so this was, a therapy that's been around since the 1980s or so, when there were a few studies done by psychologists that, were considered groundbreaking in a lot of ways. They showed with kind of intensive therapy that children with autism could change their behaviors. They could get help socializing and just, acting in ways that are safe, not eloping, for example. Running away is one that, we saw them working on in the clinic we visited. So this therapy was developed in the 1980s. It didn't really become big business until the 2010s, when a number of states, well-intentioned, passed mandates requiring insurance plans to cover this. The therapy can be very expensive. Families of children with autism really lobbied for this insurance benefit, saying, we can't afford this if our insurance is not going to help. And essentially, got all these mandates passed. Medicaid followed in 2014, which is the federal state health insurance program that covers about 50 million poor Americans. And all of a sudden, there was an insurance mandate, and you really saw this business boom. Private equity has gotten very interested in these clinics. One recent study estimated that private equity firms have opened or acquired 500 ABA clinics recently. And so the market,
In North Carolina, sorry to interrupt, but
national,
nationally, okay.
yeah. In North Carolina example, though, we did have some figures showing that there were 60 or so clinics in 2019, and now they are up to 409. So a huge boom, bigger in some states than others. And some of that is getting care to kids who need it. There's certainly more access than there was a decade for children with autism. But in our investigation, we also found that some of that is pretty profit motivated and leads to overprescription of hours, undertraining of staff, and that kind of combination, kids spending long hours in these clinics with staff who have not a lot of training, can lead to some unfortunate unsafe outcomes that we wrote about.
We're talking with Sarah Kliff, who is an investigative reporter at the New York Times, about a report that she and her co-reporter, lots of reporting here, Margot Sanger-Katz, published. It's a major investigation into how the applied behavior analysis therapy industry has exploded into a multi-billion-dollar industry. Listeners, we're inviting you into this conversation as well. 212-433-9692. Do you have questions about either the reporting that you've seen, or about this industry in particular? Sarah, let's bring Marlene in Highland Park, New Jersey, into the conversation. Hi, Marlene.
Hi. Yeah, I have a lot of questions about this. I'm glad it's finally come to the forefront, because I've seen pretty bad. I'm off of a 40-plus year history of working in home health, and there are some great ABA programs, but from what I've seen now, there's a proliferation of people who are not medically oriented, but they see it as a profit opportunity. And I see it in my town. We have a full-time ABA facility opening shortly. I used to live in Lakewood, New Jersey, and the numbers there are incredible. And it's worrisome. I'm a PT, and when I went into home health, there were extreme guardrails. And now I'm seeing so many other programs that I really question, do people need this, including ABA?
Thanks, Marlene, for the call. We appreciate it. ABA, of course, is this applied behavior analysis therapy that we're talking about. Sarah, talking about underqualified people, you mentioned that as part of one of the issues that you uncovered in your investigation. So talk a little bit about that.
Yeah, so the folks who are the way this therapy works is you have a therapist with a decent amount of training who is writing up these plans, figuring out what the kids need to work on. They then give that information to someone called a behavior technician who works directly one-on-one with the child. A behavior technician typically has 40 hours of video training, some shadowing work, and completion of an oral exam before they start working with kids. And that is not specific to the clinic we wrote about. That seems to be pretty common across the country. We interviewed a lot of people who worked in that position, and they felt like that didn't, that basically week or so of training with a few other things, it did not get them ready to work with children with autism, some of whom had pretty challenging behaviors. I talked to one who worked at the company Complete Kids who said, a few weeks after starting, one kid went into a real rage, throwing things, knocking over bookshelves. And she just said, I didn't have the skills to deal with this. There were smaller kids who were kind of hiding and I was trying to keep them safe. And you're talking about people, who, again, like do not get a lot of training. They're typically earning $20, $25 an hour for this kind of work, something similar to maybe a retail job. But working with some children who have challenging behaviors. And I think that is something, there's a lot of turnover in this industry because a lot of workers find the work very challenging for, the pay that they're receiving and ultimately decide to seek new employment.
Well, you talk about earning $20 an hour for some of these lower skilled workers in these autism clinics. How does that talk about how that differs from what is actually being billed, for example, to Medicaid? As we're talking about profits here, there's a lot of profit here and a big gap between what Medicaid is paying and what these workers, as you say, are earning.
Yeah. So it's usually around 70 or so dollars an hour paid for this therapy. And this is by Medicaid, the public health insurance program, which is paying for about a third of all ABA therapy, we think, in the United States. So $70 an hour, the workers are making 20 to 25. Obviously, there's overhead. They have to buy the clinics. They have administrative staff, but it is enough of a margin between those two numbers that private equity has gotten very involved and sees this as a really promising investment, a place where you can stand up the clinics pretty quickly, again, because you can train the staff much faster than you could train a physical therapist or a speech therapist. And that makes it a pretty appealing investment to these private equity firms.
Just to be clear, these clinics, we're saying clinic, right? They're treatment centers. These are not substitutes for school.
No, they are not providing education. Although sometimes one thing we learned in our reporting is they are recommending to parents that they pull their children out of school so that they can attend therapy full time. Many of the kids in treatment are preschool age, 3 or 4 years old, but once they hit kindergarten age, we discovered that some kids and some clinic staff we talked to, parent staff we thought this was really to their detriment, that they were being deprived of education they could have by staying in full-time therapy.
Let's zoom out a little bit again to get back to that question of kind of how we got here. There was a study done in the 80s that involved a very small number of preschool kids. Talk to us about that study and how that gets us to where we are today with this multi-billion-dollar therapy
So this was a
industry.
study, from the 1980s. It's known as the LOVAS study, and it's pretty well known in the circles of people who do this work, where there were 38 children, and half of them got 10 hours a week of therapy, pretty low key. Half of them got 40 hours of really intensive therapy, all of these children with an autism diagnosis. At the end of the study, they found the children who got the extensive 40-hour-a-week therapy had better behaviors, than they'd improved on some of the behavior parameters they were looking at, socialization and communication, compared to those who were getting 10 hours. Now, and this kind of became a foundation for the idea that 40 hours a week might be necessary to, really make some inroads with children with autism. Future research has had, or additional research that's come out more recently, has had more mixed results. There was a large review of the evidence published in 2018. It found weak evidence that for some kids, this could lead to an improvement. You see different countries making different decisions about whether this is a service worth paying for. Some provinces in Canada do pay for it. They see value in the service. The national healthcare system in Britain, however, has evaluated it and said it is not a service worth paying for. So that healthcare system doesn't. And I will say that initial study, it's pretty different than how this therapy is practiced today. In that study with the 38 children, there were negative consequences when children behaved inappropriately. One of them that struck out at me reading that study was they could hit children on the thigh when they engaged in an unwanted behavior. I've talked to many therapists who say that is not part of modern ABA, but the study that a lot of this is based on, it had some pretty different methods that a lot of people would consider unacceptable right now.
Well, to the layperson here, a study involving 38 children that then spools itself out into a multi-billion-dollar industry sounds like it's not a very solid scientific foundation for a therapy. Are you
Yeah,
here?
it's a mixed body of research, I would say. There are studies that support it. One issue you do run into is
And
industry
bigger
funding.
studies, right? Bigger
There are
studies?
larger, yes.
Yeah, okay.
There are bigger studies. That's one of the things that's really tricky, though, in studying this is that it's not like, running a drug trial on Ozempic where you have a set medication and you take it at set doses and you can record a really tangible outcome, weight loss. The therapy is, it's delivered by individuals who are not as standardized as, a dose of a medication. The hours can vary really significantly from one kid to another. The practices down to what rewards do you give kids? What behaviors are you working on? Just make it a really difficult study or treatment to study. So there just isn't a lot of rigorous research in this space. And it's just harder to study than kind of a traditional medication.
You're listening to The Brian Lehrer Show. We're talking with Sarah Kliff, an investigative healthcare reporter from the New York Times, about her reporting on the booming business of autism treatment clinics. If you're a parent of a kid with autism who receives care at a similar type of clinic, or maybe you're a worker, we've already heard from one former worker, at an autism treatment clinic, we'd love to hear your experiences. You can call us and text us both at 212-433-9692. Let's talk with someone in North Carolina here. William, you're in Charlotte. This is where, not Charlotte specifically, but North Carolina is where some of your investigation centers, Sarah. So, William, welcome to the conversation.
I am very happy and pleased to hear that Sarah has opened up this old can of worms, because as everybody knows, this abuse has been going on in every branch of the healthcare system, not just autism. There has been many fraud charges brought against people with opioids and this and the other. But anyway, down here, I haven't heard anything about it. I mean, I'm going to bring it up to some of the local radio stations. I call them up, and nobody says anything about it. But when I moved here in '95, and my son was diagnosed with autism and I guess Asperger's they call it. And the first thing the doctor went to the pediatrician, and she wanted to just give him a pill. I think it was Adderall, and I said, we're not doing that, and we walked out. There had to be therapy or something else we can look into. Now this is 98, 97, 98. My ex-wife was very much into, a doctor says jump, and she would say how high, and I put my foot down on pills because I know what it does, and I know certain kids, they need it. They're severe, but he was not. He just needed a little attention. Anyway, as an adult now, he's now 32 and lives at home. But he was with these kids with autism. When you diagnose them and you label them, they take that to heart. They're very black and white. There's no gray area. So Sean, unfortunately, had a job and everything, but mom kind of steered him to stay at home and give him disability. But anyway, I'm glad. I'm happy that I'm going to read the whole article and spread the news around here in the community, because this racket has been going on for far too long, and I'm very happy that she was able to investigate this.
I appreciate that, William, and we do encourage you to read the article for yourself, of course, as always. Any comments there on William's comments, Sarah?
Yeah, one thing it raises is, I think one reason parents flock to this treatment, who's mentioning his own experience, is that it can often be difficult to get high quality treatment. And I spoke to a lot of parents, some who felt like they stayed in ABA clinics longer than they should have looking back. And one thing they would describe to me is, their child wasn't doing well in daycare, got kicked out of daycare maybe, and then came along a facility that says, well, they can come here. There's no chance of them getting kicked out. We're going to work on their behaviors. And it's often free for parents. Childcare can cost over $1,000, $2,000 a month. This treatment is often fully covered by health insurance. So I do get, for parents of children with autism, why this can be an appealing option to them, and that they look around and there just aren't a lot of other great options that allow them to continue working, that say they're going to help their child with their behaviors. And I think that is another factor kind of describe that helps influence the growth of this industry that we've been seeing.
Talking about the growth in profits, and specifically the involvement of private equity in this. You mentioned earlier about the just explosion in the number of clinics popping up nationwide. Talk to us a little bit about the length of these clinic visits, because they have also grown longer, which translates to more money?
Yeah. So these companies, like I mentioned earlier, they tend to be billing, whether it's private insurance or Medicaid, in 15-minute increments. So the longer a child is there, the more revenue they're earning from that particular child. We talked to former clinic workers, at clinics across the country, who said they faced pressure to overprescribe hours. And the number that people often hit is 40 and say, this child needs 40 hours of therapy. There was one woman I spoke with who worked at some private equity owned clinics in Arkansas and Texas, who said, the attitude was often, look, they're 3 years old. They don't have much going on. They have the time to be here 40 hours a week. And then, we wanted to bring some data to that. So we worked with a company called Trilliant, a health data company, to look at nationally what's going on. And what we found was pretty striking. We found that the average visit since 2019 has gotten 1.5 hours longer, from about 4 hours for a typical visit to an ABA clinic to 5.5 hours. We also found the share of visits that are 8 hours or longer has gone up from 9% to 16%. There is not a clear explanation for something that has changed about children in the last 7 years that would suddenly require much longer visit hours. So something has been changing. The visits are getting longer. And the people we talked to felt very strongly that this had to do with generating revenue from these children.
Sarah, let's bring Anne in Long Beach into the conversation. Hi, Anne.
Hi, thank you for taking my call. I just wanted to say I'm hearing the problem with the exploding, clinic openings and stuff like that. And I get all of that. I have a number of disabled children. One of them is a little boy that's 5 years old with nonverbal autism and tremendous behaviors. And we have Medicaid. He's got Medicaid. We had to wait to get hours approved for him. He finally did get 30 hours per week approved, maybe 6 months ago. We have a wonderful therapist, and the ABA is really helping him. So I just wanted to say that. There's a lot of negatives, I guess, in the money part, but in the helping of some kids with autism, I think it's beneficial.
Yeah, glad to hear that. Thanks so much for the call, Anne. We appreciate it. Sarah, you write that 80% of the patients in these clinics, the complete kids clinics, there it is, in North Carolina, 80%. This is in North Carolina, right? This number, 80% of its patients are on Medicaid, as Anne was saying. On the surface, that seems like a really wonderful thing, right? Helping underserved kids who need the help. You did talk to employees who say, despite that, they had concerns.
Yeah. And I, speaking to your caller's experience, I do think there are families that have been wonderfully served by this. She was just describing, and even at Complete Kids, I did talk to and include in our story multiple parents who said their children's behavior had really improved from the therapy there. At the same time, there were these set of concerns raised to us about hours being overprescribed, sometimes unsafe situations for children that we wrote about, and that this being motivated more by profits than about helping children. So I think it is possible, both things are true. There are children who are being served by this. There are also some people who are thinking more about the profits in this space. And I did hear after the story, some worry from advocates about, worried about with additional scrutiny, are they going to face cuts? Because it does seem like, as I and some other journalists have been writing about this area, states are taking a new look at their Medicaid spending and trying to think about, how should we be serving this population and how can we best spend those dollars?
I mentioned in the opening remarks here of our conversation about some abuse that you reported on.
Mm-hmm.
So I think we shouldn't leave that without talking about it. If you can just tell us what you uncovered, the kind of abuse you reported on.
So there is very little information known about how often instances of abuse or assault happen in ABA clinics. What I did is I reached out to police departments in all the cities where Complete Kids operates and requested any incident reports that the clinics had generated over the last few years. We found 12 reports of some kind of assault or abuse related to a Complete Kids clinic over the last few years. Some of them resulted in criminal charges. Some of them were investigated and found to be unfounded because there was not enough evidence to support them. One of the ones we wrote about that really jumped out to me was the case of a girl last summer, a 4-year-old girl who came out of the clinic with what looked like a bite mark on her arm, a circle. And her mom asked her what happened. The little girl tells her mom, according to the police report, teacher bit me. This was one of the cases that later led to criminal charges and a guilty plea from that worker. When we talked to, about why these things might be happening in these clinics, one of the things we learned is that despite children spending long hours there, that these autism clinics are much less regulated than daycares. They're treated like a medical office building rather than a facility where children are spending a large chunk of their day. They do not get annual inspections, typically like a daycare would, or in North Carolina. Any kind of violations found on that inspection go in a public portal that families could search. That doesn't exist for autism clinics. So there's a little bit less clarity to parents who might be sending their children there about what is actually happening inside the clinic.
The last thing I want to touch on here is something that I also mentioned that I don't want to leave, which is the Trump administration identifying autism therapy as a, quote, high priority focus for fraud. And they sent letters to 5 states about this fraud. You report that on the same day that your investigation was published, prosecutors charged 2 Minnesota autism clinic operators with fraudulently billing the government tens of millions of dollars for services never delivered. So talk to us about why the administration is focusing in on that.
Yeah, I think this is a little different than what I reported on, but at the same time, there have been a number of prosecutions from the Trump administration related to fraud in ABA services. So these are cases where someone is billing for services that were just not ever delivered to a child. And there was a recent prosecution the same week that my story ran against 2 Minnesota residents who are charged in a scheme of giving parents essentially kickbacks to get their children diagnosed with autism so that they could start billing those children for autism therapy that may or may not have been delivered. There have been a number of investigations from HHS that have found in multiple states, in Colorado, in Maine, I think a few others, cases of clinics billing therapy for things that are not therapeutic activities. For example, billing Medicaid for when the child is napping or when they're playing at the playground or eating lunch. And I think those investigations, which all, date back a few years, kind of predated these prosecutions we're now seeing from the Trump administration.
All right. Well, you listeners, you can read the investigation yourself. Sarah Kliff is an investigative healthcare reporter for the New York Times. She and her co-reporter, Margot Sanger-Katz, published that major investigation into how the applied behavior analysis therapy industry has exploded into a multi-billion-dollar business. And I'm sure you can find it on the New York Times website. I'm sure of that. Right, Sarah?
Yes, you can.
Okay, great. All right. Sarah, thank you so much for your time, and we really appreciate you coming on and talking to us about all of this.
Yeah, thank you so much for having me.